This video aims to showcase the guidelines for patients under investigations, or PUI, for COVID-19, published by the Department of Disease Control, Ministry of Public Health, Thailand, on the 1st of May, 2020. The suspected cases are classified into 4 groups, consisting of disease prevention and control at the airport, suspected patients with respiratory symptoms, healthcare professionals, and a group of symptomatic patients with the same risk of exposure. Most patients present with fever, usually more than 37.5 degrees Celsius, unspecified respiratory symptoms consisting of dry cough, rhinorrhea, sore throat, anosmia, tachypnea, and dyspnea. In addition, history of recent travel to high-risk countries, high-risk occupations, history of contact with individuals tested positive for COVID-19 increases the tendency of COVID-19 infection.
Good morning.
Good morning. Please take a seat.
Thank you.
My name is Dr. Aruntharo Janakun. May I have your name, please?
I'm Kochakon Mekhabatikun.
And your date of birth?
31st of October 1997.
So, what brings you here today?
I've been coughing for a few days now.
How long have you been coughing?
It's about 3 days ago.
Do you have any phlegm?
No, it's just dry cough.
Any fever?
Yeah, I feel a bit feverish.
How long have you had the fever?
2 days ago.
Did you take any temperature?
No, I didn't, but I was shivering yesterday night actually.
Alright. Did you take any paracetamol for your fever then?
Yeah, I took some, but it didn't really help. I was still shivering afterwards.
Do you have any other problems such as sore throat?
Yes, my throat has been hurting for a few days.
Alright, what about shortness of breath or tightness in the chest?
I do feel breathless sometimes.
Have you ever felt breathless before?
No, never.
Have you ever heard wheezing sounds when you exhale before?
No,
Have you ever had to use an inhaler before?
no.
Alright. And have you experienced any loss of smell?
Yeah, actually this morning I can't smell the car fresheners.
So may I ask, what's your occupation?
I am a taxi driver.
Was any of your current passengers a foreigner?
Oh, I think I took some Chinese passengers a week ago.
Were they wearing masks?
No, they weren't. And they were coughing as well. But I wore my mask. That should be okay, right?
Right. It's good that you take precautions. And did you happen to visit any high-risk places?
What do you mean high-risk places? Can you give me some examples?
Like the markets, boxing stadium, or nightclubs?
No, I like to stay home when I'm not working.
Alright. Does anyone in your household have similar problems?
No, everyone is healthy.
Right. Have you received the flu shot this year?
This year? No.
Did you come into contact with anyone with the flu?
I don't think so.
Were you exposed to anyone who was tested positive for COVID-19?
No.
Alright. Now let me do a little physical examination.
That's fine.
Alright. You have a high temperature, but your lung sounds normal. However, because of your symptoms and a history of contact with passengers from a high-risk country, you are at high risk of COVID-19 infection.
Does this mean I'm already infected?
We will need to do further investigations. You will have to take a chest x-ray, and we will be taking 2 swabs for your nasal cavity and your throat, one for the flu and the other one for COVID-19. It might feel a bit uncomfortable. Is that alright?
That's fine.
The flu results takes around 1 to 2 hours, but the COVID-19 results is going to take around 24 to 48 hours.
And does this mean I have to stay at the hospital? Because I have a passenger to pick up this evening.
Because you have shortness of breath, we recommend that you get admitted to the hospital regardless of your swab results for close monitoring and appropriate treatment.
Oh, okay. I'll just have to cancel his booking then.
Do you have any other questions?
No, that's all.
Alright, since you are at high risk for COVID-19 infection, I suggest that you and your family wash your hands regularly, wear masks, and practice social distancing.
Alright, I'll do that. Thank you.